Hi, everyone. My name is Ellen Strunk. I am president of Rehab Resources and Consulting, and I'm also a NARA member. I'm here to provide just a short brief on the proposals in this year's skilled nursing facility rule on the Skilled Nursing Facility Quality Reporting Program. It was a very big section this year. So CMS has proposed to modify the COVID-19 vaccination coverage among healthcare personnel measure to adopt the discharge function score measure and remove 3 measures from the SNF QRP, all effective with the FY 2025 SNF QRP. And then the following year, they want to adopt the Core Q short stay discharge measure and adopt the COVID-19 patient residents who are up to date measure. So just a little bit about each of these. The HCP COVID-19 vaccine measure would be updated so that the term complete vaccination course would be replaced with the term up to date. And in doing so, they would specify the timeframes in which an HCP would be considered up to date, including booster doses. The proposed discharge function score measure is an assessment-based outcome measure that uses the Section GG items that we are already collecting. It looks at reports the percentage of SNF residents who meet or exceed an expected discharge function score. Now, it's modeled after the current IRF functional outcome, discharge self-care, and discharge mobility measures, but it differs in 2 primary ways. One is it considers 2 dimensions of function. So it pulls 3 items from GG self-care and 8 items from GG mobility. And secondly, it accounts for the missing data. That means those items that you score with a not attempted code, rather than just recoding all those items to the lowest possible value. It uses a statistical imputation method that recodes missing functional data with the most likely value had the status been assessed. So that would be effective also in the fiscal year for the fiscal year's 2025 SNF QRP. Now, the 3 measures that are proposed for removal are the process measure, the application of the percent of long-term care residents with an admission and discharge functional assessment and a care plan that addresses function. And then also the change in self-care measure and the change in mobility measure. So what does that mean for us operationally? It means that effective October 1 of 2023, if these are finalized, that we would no longer have to complete at least 1 self-care or mobility goal on every patient admitted for fee-for-service care. And CMS said that they would be updating the assessment tool the next time that one is released. Now, for effective October 1 of the fiscal year 2026 SNF QRP, CMS proposes the Core Q short stay discharge measure, which calculates the percentage of residents discharged in a 6-month period within 100 days of admission who are satisfied with their SNF stay. So what it is that it's only going to measure satisfaction on residents that are short stay and that discharge. Now, there are 4 primary questions here, which makes it very simple to complete, but there are also a lot of exclusions to the measure. So that means that there may be several of your patients who don't receive a survey. However, this measure is going to be applicable to all patients, all short stay patients, regardless of their payer status. The score then is the sum of the residents' responses, and it's going to average that out and report the number that have an average score of greater than or equal to 3. And SNFs would have to start collecting this data if it's finalized as soon as next year. And then finally, the 5th measure is a process measure that reports the percentage of stays in which residents in a SNF are considered up to date on their COVID-19 vaccine per the CDC's latest guidance. Now, there are no exclusions for this measure, and if adopted, it would require that an item be added to the MDS assessment. So the measure couldn't be collected until at least October 1, 2024. There are also a few other proposals. CMS wants to increase the data completion threshold for MDS assessment data to 90%. Currently, that number is 80%. So if it's finalized, then what it means is that 90% of the MDS assessments a SNF submits must contain at least 90% of all of the required data elements. And then finally, there is request for information on principles that CMS should use to select future measures. There's an update on what CMS is doing to meaningfully incorporate advancement of health equity into the QRP. And then finally, CMS proposes to begin public reporting of the transfer of health information to the provider and patient measures that we start collecting in October, the DC function score measure that is being proposed in this rule, and then the COVID-19 patients, residents who are up to date measure. So lots to think about, lots to dive into. So happy reading.